Shall we begin? Shall we begin? Okay, I guess we are live now. All right. So, hello everyone. Good evening. My name is Ishita, and I welcome you all to Worldify Academia Hub. We are so happy to bring you all here, and we are so happy that you all have joined us for the live show. Today, with me, I have Sonia ma'am. Hello, Sonia ma'am. Good evening.
Hi, Ishita ma'am.
Hello, Sonia ma'am. How are you doing?
Good, I'm doing good.
All right. So, Sonia ma'am, could you please give us a little introduction about yourself so the students can know more about you?
Of course. My name is Sonia. I'm one of the OET faculty now recently started in Worldify Academy Hub. I'm welcoming all to our speaking session. I hope it will be a useful session for you guys. So keep on watching, stay tuned.
All right. Thank you so much, Sonia ma'am. We are so happy to have you with us here in the live. All right. So, everyone, we are going to begin with the speaking test format today. Basically, we will be talking about the speaking module. We will be discussing about the structure of the speaking test, what you will need to prepare for the role play card, and the duration of the test and the role play. We will also talk about the interlocutor that is there. And in this whole live session, Sonia ma'am is going to help us throughout, and she will be also there. She has given OET exam and she has successfully gotten B grade in all the modules. That's really well done, Sonia ma'am.
Thank you.
And
Thank you so much.
yeah, right, definitely. So, in the end of the live show, we will be having the conversation, an example conversation between me and Sonia ma'am, so that you all can get a better idea of how the conversation takes place, what you should say, what you should speak, what you should avoid while you are in the conversation with the interlocutor. So, let's just begin with this now. All right. So we will be starting with, the discussion of the structure of the conversation and the speaking module test. So basically, total 20 minutes of test will take place. Face to face, it will happen face to face. You and interlocutor will be there in the room, and the total time of the test will be 20 minutes. The test will be recorded, and the test will not be, only with you. There will be an interlocutor who will be basically asking you the questions regarding your professional background, basically the person who will be taking your speaking mock test. And only with the with the interlocutor only you will be speaking, and you will give your test. Then you will have warm-up questions. Warm-up questions will be for 3 minutes, and they can be related to your professional background. They can be related to your just introduction. The interrogator will ask you about your introduction. They can also ask you about your OET journey, and questions like, could you please describe a moment in your professional life where you felt happiest being a nurse or a doctor? So such kind of questions can be there as your warm-up questions so that the interrogator gets a good idea about your personality, and if they are selecting the, appropriate candidate. Then two role plays of 8 minutes will take place. We will talk more about the role play cards. Let's move forward right here. So we have the role play card. Basically, after 3 minutes of conversation, 3 minutes of warm-up questions will take place. They will ask you about your introduction. You will have to introduce yourself, and you can tell them about your professional background, your education, how many years of experience do you have, and there can be questions like, what was the moment in your professional life where you felt really good being the nurse? What is rewarding about the nursing profession, or the what is rewarding about the healthcare field? So such kind of questions can be there just to know more about your creativity and intellect. And then after 3 minutes of warm-up questions, there will be a role play card. Now, in the role play card, basically, you have to enact. You will get a card, there will be a scenario given to you. on that card, and the scenario will basically be like you are head nurse of the Spirit Hospital, and you are in conversation with Mr. Michael, 72 years old patient who just got into an accident and he has just returned to Australia. Now you have to instruct Mr. Michael how long he will be there in the hospital, how long he will be taking his medicines, and everything. Every query that he has, you have to answer that. So this will be your scenario, and you have to enact the role of the nurse. Below that, you will have your tasks. Tasks are basically the things that you will have to speak in your conversation. The whole conversation will take place for 5 minutes. Now, 3 minutes are given to you to prepare that cue card, the whole scenario, to understand your tasks, to keep in mind the statements or the questions that you are going to speak. Now, the role play card will have three elements. Basically, there will be a setting. The setting will be the location of the conversation, where the conversation will be taking place. Now, settings can affect your conversation. It can be hospitals, it can be healthcare center, it can be any clinic. So that will kind of affect your, conversation. You can understand where you are with the interlocutor, and then you can, improvise your tone and you can speak in that manner. The background will be the scenario given to you. The tasks will be the things that you have to speak. Now, speaking role play card, you will get 3 minutes of preparation time. After 3 minutes of warm up questions, you get 3 minutes of the preparation time for your role play card. Role play. Role play will take about 5 minutes. Candidates are required to enact their professional role in real life scenarios in a professional healthcare environment. Now, you will be enacting the role of a nurse, and the interlocutor will be enacting the role of a patient. So you will get the nurse's card and the interlocutor will get the patient's card. The scenarios will be same for both of you, but you can assume, you can just think that a little difference will be there. The tasks will be different for both of you. Interlocutor as the patient will be asking you questions. Maybe the interlocutor will be, enacting as an anxious patient. Okay. You will have to stay calm and you will have to answer their queries, whatever they are asking. So you don't need to worry that how different the interlocutor's card is from your card. It will be really similar, almost same, because the scenario is same. If one tip that I would like to give here to all the students regarding the role play is that many students just feel that if they are not seeing the interlocutor's card or what are their tasks, they might get everything wrong. But that's not the case. Suppose in your cue card, if it is mentioned that reassure the patient regarding their treatment, you have to reassure the patient, the interlocutor, regarding their treatment. Then that is quite obvious then that the interlocutor as the patient will be behaving in an anxious manner. So you can just know, you can just understand that the task in the interlocutor's card will be given like act anxious, pretend to be anxious. Okay, so such things will be there. You can understand from this. If something is given in your card, something similar to that only is given to the interlocutor's card. So you don't need to worry that my card is so different from the patient's card. There is 1 minute break between the two role plays. Total 2 role plays will take place of total 8 minutes. Time duration of each role play is 8 minutes. You will get 3 minutes for preparation, 5 minutes of conversation will happen. And that is your 20 minutes of speaking test. Summing it up, everything, 3 minutes of warm-up questions, 3 minutes of preparation given to each role play, and 5 minutes of conversation will take place. That makes up your 20 minutes of speaking test. Now we have, again, the description of role play. As I told you all, there will be 3 parts: settings in the role play card. It is the place where conversation takes place. There are different types of settings like hospital, community healthcare, school, clinics, etc. Background information. It is the brief description of the scenario. the scenario, you have to understand what is given there, what is the situation given to you. You have to change your tone, the way of speaking, the set of vocabulary according to the scenario. If the scenario is like an emergency situation, then the tone and what you will be speaking will be different. You're not going to stand there and just give introduction of yourself in a calm manner. You will be rapid with your conversation. Then, if it is a conversation or like a scenario is given where the patient has just come to you for some advice, they have not met with an accident, they are properly fine, they're just here to take some advice on something. So, there you can introduce yourself and the tone of the conversation will be a little calm. Tasks are the things that you have to speak during your play. Example, ask question to the patient about his or her conditions, give instructions. And that makes up your whole role play card. Now we will have, okay, so now here we have an example of the role play card. Basically, this is how an interlocutor's role play card looks. Patient setting is given, community health center. Then, as you can see, the scenario is given, 4-line scenario is given, and below that, we will have our tasks. Now, in those 3 minutes of preparation, you have to read these 3 things: settings, scenario, tasks. One thing that I would like to suggest, many students, while they are in the test, they think that, okay, I have read my scenario, I have read my tasks, I'll just, have the conversation spontaneously. But that's not really, advisable. I would suggest for each task, suppose you have 6 tasks given to you in the cue card, I would say have one statement or a question, relevant question or a statement, in your mind for each task so that you can base your conversation around those things. It will be very difficult for you, might be difficult for you if you have, if you are just starting with your conversation with a blank mind. So it's better that you have a statement or a relevant question for each task in your mind. Then here we have the candidate's role play card. So basically, this is your card. This will be your nurse's card. And nurse setting, community health center, scenario is given, and then tasks are given. Now here, if you see, for nurse, 6 tasks are given. For the interlocutor, only 4 tasks are given. Now you don't have to worry here. You don't have to think that, oh my God, my tasks are more than interlocutors, so that, I have to speak more. And you don't have to worry about that, because make sure that you are the person driving the whole conversation. Make sure that you have the steering of the conversation in your hands. It will be a very difficult situation for you if the interlocutor initiates things while you are in the conversation in those 5 minutes. Please try to avoid that situation where you go blank and the interlocutor has to do all the work. Please try to avoid that situation. Make sure that you are confident and you are the one initiating the questions. You are the one asking things. You are the one telling things. And yeah, that's one thing. Now, we have here Sonia ma'am with us, and me and Sonia ma'am will be enacting the role play. Here, I will be the nurse and Sonia ma'am will be the interlocutor. All right, Sonia ma'am.
Yeah, sure.
All right. I hope you are ready, Sonia ma'am.
Yes, I am ready.
All right. So everyone, you can take, help from our conversation. You can note down the statements that we will be speaking. You can note down the questions, maybe vocabulary words if you like any from our conversation. And you can take note of the way we are talking in this conversation. Now we have, all right, Sonia ma'am, I think we can begin.
Yeah, okay.
We have here, all right. Let me just. Okay, so let's start. Because I'm the nurse, so I will be initiating the conversation. Another thing, just before we begin with the conversation, I would like to tell all the students that you do not get the interlocutor's card in your test. You will only get your card. You will not see the card of interlocutor. And that is a good point. Don't think that that's a negative point. Do not think that if you got interlocutor's card as well, you could just look at it and you would just know that what the interlocutor is going to ask you. No. If you look at the interlocutor's card, you will get confused. You will not only say your things, but you will in fact say the interlocutor's things as well. And that is where you're going to lose your mark. So please, it's a good thing that you will only look at your card. Now, Sonia ma'am, we can begin with the conversation.
Sure.
All right. All right. Okay. Good afternoon. Welcome to the Community Health Center. I am Nurse Janet, the nurse practitioner here. It's nice to meet you. How has your day been?
Hi, thank you. It's been all right, just a little bit busy.
I understand life tends to keep you busy. I'm glad you could make it here today. Before we get started, could you please share a bit about yourself? What brings you here today?
Well, I've been thinking about quitting smoking, especially since I recently became a new parent. I'm just not sure where to start, so I want some definitive advice from you. That's why I'm here.
Well, that's really nice. Congratulations on becoming a new parent.
Thank you. Thank you so much.
Well, that's a significant change in our life, and that's wonderful that you have decided to quit smoking finally. Quitting smoking is a commendable decision, I must say. To get started, could you please tell me a bit about your smoking habits? Like, how many cigarettes do you typically smoke in a day, and for how long has this all been going?
I've been smoking around 20 cigarettes per day for the last 25 years. I used to smoke by rolling my cigarettes mostly. I was making myself every day. I used to smoke every morning, only a few, and during nighttime, little bit like that.
Oh, I understand that. Thank you so much for sharing that. It actually takes courage to share such information with, a healthcare professional. We can discuss about, the motivation to quit. So, what exactly is your motivation to quit? Basically, what led you to consider giving up smoking at this particular time in your life?
Well, I know smoking is actually injurious to health, and now I decided to quit smoking for my baby as well as for my health, as even for my health also. Overall, a well-being of our family.
That's really nice. Those are really powerful reasons to quit such a habit.
Mm.
Have you faced any specific challenges or concerns about quitting that you would like to discuss with me?
Yeah, earlier I tried to engage in some other activities whenever I feel to urge to smoke. For instance, like by doing some kind of pleasant activities such as calling my relatives, spending time with them, or like watching movies, enjoying some delicious food, something like that. I was trying to make myself in a busy schedule, but now I'm really worried about the cravings and the stress triggering me to smoke again and again. So I need your help in that one. Can you?
Yeah, definitely. I can help you out with that because that's a really common concern, and we can certainly work on strategies and, just to manage those challenges that you're facing together. I would just like you to know that you are not alone in this journey, and there are many patients and people with us who are supporting you right now, and we will support you throughout the journey. I would just like to know more about your, smoking habit.
Yeah,
Did you
sure.
try any positive changes in your life, like, calling up a friend or having delicious meals in the evening?
Yes, of course. I tried that way, but still I was really I have still urged to take that one. That's why I need some definite advice, like what I can do further. I tried in those ways, but I really failed.
I totally understand that. Well, we can explore more options together. Additionally, I would just like to mention a couple of aids that could support you in quitting. Have you heard about Champix tablets? They can really help reduce cravings and
Really?
block the rewarding effects of cigarettes. Yeah.
Oh, no, I haven't heard about that one. How does that work?
Yeah, okay. I would love to tell you more about that. So basically, Champix is a prescription medication that has shown effectiveness in supporting smoking cessation. I can prescribe it for you if you're interested. Also, electronic cigarettes can be another option, very popular. and a great treatment for, quitting smoking as well. They satisfy cravings without any harmful effects.
Thank you so much for sharing that vital information. But electronic cigarette, like how does that work? How I should use that one? Can you share that one, please?
Yeah, sure. So basically, electronic, cigarettes can help you just eliminate or just curb the cravings, and you can use the electronic cigarettes. It will not have any harmful effects on your health, and yeah, it is kind of used because whenever someone tries to quit smoking, they cannot quit smoking just all of a sudden. So slowly and steadily, if you take the help of electronic cigarettes, it will be really beneficial for you.
Sounds good. So I would like to do it like that.
Sure. So we can discuss the pros and cons together, and we can plan on something that suits you. How about
That
we identify the triggers, rewards, and benefits of quitting smoking as well? For
that's
instance, more money is saved. Yeah. And we will be able to create a healthier environment for your baby as well. What do you think about that?
sounds good. So let's do it.
Definitely. Fantastic. So we can set a quit date and I'll prescribe the Champix tablets to you and I can recommend the electronic cigarettes as well. And we can have a detailed plan. How does that sound?
That sounds great. Let's get started.
Perfect. Just remember that you are not alone in this journey and I will be here. And there are many people with us that are there to support you throughout your journey. We're in this together. Thank you so much.
Thank you so much.
Thank you. All right. Thank you so much, Sonia ma'am, for the conversation. Lovely conversation with you. All right, everyone. So I hope you all took some notes from this conversation. And me and Sonia ma'am, both of us together, we were able to answer some of your queries without taking your queries. But I really hope that this session really helped you out. Yes, Sonia ma'am. Would you just like to say something to our students? An
Yes.
advice or any tip that you would like to give?
Yeah, of course. I used to tell every students, whenever you are starting your conversation, like in between the starting of all the sentences, every time we need to thank to the patient, like if at least like an appreciation or thank you for your question, just response to the patients. First thing we need to respond to the patient. Then only we will start our like whatever we want to explain to the patient. After that only we will explain. And end of that sentence ends when like just drag a question there to the patient. Like how does that sound? Are you following? Do you understand? Do you get my point? Or do you have any other concerns? Anything. So whenever the nurse is talking, our complete sentence, first line should be the response to that patient. Then we can talk like ask the task. Then at the end, always drag a question to the patient. So it's like a two-way communication.
That's
That's it.
really good advice, Sonia ma'am. Thank you
Thank
so
you.
much. All right. Okay, everyone. So that was all for today. And please keep practicing. And we will be coming back for, your support. And we will be bringing more such tips and strategies for each module. Thank you so much.
Thank you. Thank you so much.